Good day, dear friends, dear subscribers. My name is Victoria Olegovna Balasanyan, Deputy and Head of the Children's Eye Clinic's Jasny Vzor. Today we will discuss nystagmus, its associated diseases, hidden ocular albinism, and common albinism, which are frequently found in children with nystagmus. These topics will be the focus of our conversation. And in general, I would like for us to have a thorough discussion about this matter today, covering all aspects of it. When dealing with nystagmus, we generally encounter three of its components. Thus, the primary one is characterized by uncontrolled oscillatory eye movements. The second is linked to the development of myopia, hyperopia, and astigmatism in individuals. The third is low visual acuity, also known as amblyopia, which can have various causes that differ from person to person. Therefore, taking into account the complexity of this problem, its treatment should also be complex, systematic, and comprehensive in nature. What is the best way to deal with uncontrolled oscillatory movements? The only effective method to combat this issue is through surgical correction procedures. What does it mean? All patients with nystagmus have a specific head position, which can be a turn to the right or left, a tilt and a glance from under the brow, or conversely, throwing back the head. It can be a combined turn, a right or left turn, with a tilt or a flip maneuver. And this point of blocking nystagmus is not detected by intuition based on the subjective sensations of a doctor or the child's parents without any objective measures or conclusive evidence to support it. Developed by us in collaboration with our Spanish colleagues under the guidance of Igor Aznauryan and implemented in practice, the GuysLab device enables us to precisely determine the specific point of nystagmus blockade and evaluate the amplitude of nystagmus at this point with accuracy. And then, as per the Straba mathematical modeling program, taking into consideration all other physiological, anatomical criteria and parameters, the calculation of the operation is determined and the surgery is performed. So, in certain instances, a single surgical procedure is insufficient, and our Straba program enables us to approximately estimate the number of surgeries that may be necessary in this situation. And after that, effectively achieving complete nystagmus blockade in the central position, we begin treatment. Treatment is aimed at improving visual acuity. What else is important about the position of the eyes? In other words, actually, when a patient has accompanying myopia, hyperopia, and astigmatism, which require wearing, for example, glasses, he can't wear them because he has a certain point of blockage. It's clear that there is no central vision anymore. It's clear that the glasses' temples and frames start to interfere, and the patient simply stops wearing glasses, which leads to a decrease in visual acuity. Thus, by attaining this central eye position, we establish the necessary conditions for implementing the most efficient conservative treatment approach. Following that, we initiate treatment aimed at enhancing visual acuity. In the event of a pronounced degree of myopia, astigmatism, hyperopia, and in some instances where they impede the improvement of visual acuity after surgical correction, nystagmus, typically around 3 months later, laser correction can be safely performed. And the most important thing in this case, that is laser correction, is carried out not to get rid of glasses, but to more effectively, qualitatively, and better cure amblyopia without the risk of any relapses in the future. Only in this case, only with such a comprehensive approach, that is, surgery is not a panacea for all STDs. Conservative treatment alone is insufficient, and at times it is merely devoid of significance. Thus, the therapy ought to be thorough and encompass all facets of this pathological state, which resulted in the occurrence of nystagmus and amblyopia in a general sense. Initiating treatment from an early age is crucial. That is, postponing all of this is highly risky, as it can lead to the development of complications, ultimately resulting in less effective treatment outcomes. So all this must be done, as well as, in fact, all other diseases we face in pediatric practice. They need to be treated here and now, without postponing for a long time. Dear friends, thank you for watching this video. Put likes, write your questions in the comments section. We will be happy to provide answers to them. and share we would like as many individuals as possible to be aware that individuals with nystagmus, individuals with albinism can and should be provided assistance.